Okay. Um, Hello, everyone. Okay. Das maray na aga po sa tuyang gabos and welcome to the third part of our Partido State University Balongibog Talks COVID-19 segment. Before I proceed, may I inform our participants that the lecture is being recorded and will be uploaded in social media after the end of the lecture. Again, I'm Earl Hernandez. Okay. Again, I'm Earl Hernandez, the Museo Isarog curator, and I will be moderating this lecture this morning. May I also remind our participants to please mute your microphones. Okay. So the Balongibog Talks COVID-19 segment is sponsored by the Partido State University through the Center for Partido Studies, directed by Dr. Danilo M. Herona. Partido Economics Institute, directed by Roland John G. Bulao, the Museo de Isarog, and College of Arts and Sciences, headed by Dean Arlinda M. Basilia. For a very short recap of our series, last Monday, Dr. Danilo Herona, Dr. Herona's lecture enmeshed the archival record of the Philippine Islands epidemic experiences during the Spanish colonization. Yesterday, Ms. Lisel Atole discussed the biology of the COVID-19, viewing the pandemic within epidemiology, pathophysiology, and diagnostics of the pandemic. Today, our lecture will be dissecting one of the key sciences behind the ECQ policies in order to help flatten the curve. So the mathematical models of pandemic. So Ms. Vanessa Romero is a mathematics faculty of the College of Arts and Sciences in Partido State University. She is currently finishing her MS in Applied Mathematics under Math in the Life and Physical Sciences track in UP Diliman. I am now giving the virtual floor to Miss Vanessa.
Wait. Okay, let me just set this up. Okay, so let me start my lecture. So last April 7th, the president of our country made an announcement, a 15-day extension of the supposedly 30-day enhanced community quarantine of the entire Luzon. Now, this may have left us with the following questions. Is the 30-day lockdown not enough to contain the disease? Is it really necessary to add few more days to the lockdown? Will it make any difference at all? May pagkakaiba ba kung magdadagdag tayo ng 15 days doon sa 30 days na ECQ? And what are the reasons for this ECQ extension? Is it economic, political? Is it politically driven? Or it's a scientific-based decision? Not unknown to the public, especially with the presence of social media, that a number of mathematicians or modelers have been sharing their works, in fact, answering the questions I've raised earlier via Facebook, Twitter, and YouTube. And some were even featured in the news such as ANC and Rappler. Good morning, everyone. I'm Vanessa Romero, a faculty of the Partido State University, and today we are going to explore, dissect these models. So, kumbaga, hihimay-himayin natin for us to have a better understanding of what these models really means or the results of these models. So for us to have a grasp of the results of these models. Specifically, we first discuss some trending terms such as hashtag flatten the curve, the reproduction number, and compartmental models, the SIR and the SEIR models. Then after that, we'll proceed with the discussion of some mathematical models. Then finally, some important takeaways from these models as and the mathematical models in general will be presented to wrap up this lecture. So we now proceed with the trending terms. First off, the hashtag flatten the curve. So, but what do we mean by flattening the curve? What even is this curve? Ano ba yan? Anong curve na yan? So the curve that we are referring to in the hashtag flattening the curve is the epidemic curve. So epidemic curve is the graphic depiction of the number of new outbreak cases by the time of the onset of the disease. So graphing in an XY plane, the y-axis represents the new number of not the new number of infected cases, but the active cases. So that means the infectious case minus the recovered individuals minus those who are already dead from the disease. While the x-axis here represents the date of the start of the epidemic. In addition, we introduce a horizontal line. So this horizontal line represents the capacity of the community healthcare system. This includes the number of hospital beds, number of hospital staff, the medical supplies, ventilators, etc., etc. Now, when an epidemic occurs without intervention on the spread of the disease, so walang community quarantine, walang isolation, and so on, the number of patients exceed this horizontal line. So it exceeds the capacity of the hospital, thus increasing the risk of mortality of the cases due to the disease. So what the hashtag flattening the curve campaign wants is to slow down the spread of the disease so that the cases can be accommodated by the hospitals. Question, yung area ba under the curve nitong nito is can be the same as the area of this curve? Yes, it is a possible scenario. However, on this flattened curve, okay, maa-accommodate yung mga cases sa ating hospitals as compared to this case. So next term, the reproduction number. So what is the reproduction number? It is how many people on the average each infected person will in turn infect in a fully susceptible population. So for the COVID-19 disease, we have a reproduction number of 2 to 3. That means kung may isang infected person sa population, makakahawa siya ng 2 or 3. And then this 2 to 3 now infected persons will infect again 2 to 3, 2 to 3, 2 to 3. So thus we will observe an exponential growth on the number of COVID-19 cases. So this reproduction number is a mathematical tool used by epidemiologists to assess the transmission and the spread of the disease. Kung gaano siya kabilis makapag-infect ng ibang tao sa population. So it is also worth noting that whenever R sub 0 or R naught, the reproduction number is greater than 1, then the disease will spread or an epidemic will occur in the community. However, when R sub 0 or the reproduction number is less than 1, then the disease will die down or will cease to exist in the community. So aside from hashtag flattening the curve, we also want to hashtag reduce the value of the reproduction number. And finally, for the last term, we have compartmental modeling. It is a mechanistic model, a technique that divides the population into different compartments, representing the different stages of the disease. So this model uses the relative size of each compartment to model how the numbers evolve in time. Now, there's just one strong assumption of compartmental modeling, and it's that it assumes a homogeneous population. What do we mean by homogeneous population? So that means the people in the community, okay, uh, so everybody interacts with everybody, which is not usually the case in reality. Now, one basic example of um, compartmental modeling is the SIR model. So what do we mean by the SIR model? SIR are the compartments. These are also the stages of the disease. Okay, so S stands for susceptible, or the number of people who can have the disease. Meanwhile, I or stands for infectious, or these are the people who already have the disease. And R is the recovered, stands for recovered. So recovered are the people who had the disease but has now cured from the disease and has gained immunity. Okay. So in an SIR model, okay, we can track the number of susceptible, number of infectious, and number of recovered through time. So for example, from day 0 of the ECQ until April 30, or until the disease vanquished from our population. Okay. So another example of a compartmental model is the SEIR model. So this is very much similar to our SIR model, but with an additional compartment, and that is the exposed. So this tracks this accounts for the incubation period of the disease. So we must remember that the COVID-19 has an incubation period, according to the references, of 10 to 14 days. And this must be reflected in our model as well. So we barely even scratched the surface of compartmental modeling. For more details on this topic, I'll be linking some references on compartmental modeling, as well as the references used in this lecture in the video that will be posted by the Museo de Isarog page. So with that, we are now ready with some mathematical models and their results, as well as I'll be mentioning the assumptions and limitations of these models. So marami na tayong mathematical models, I guess, na nakikita sa social media, and sometimes we just focus on the numbers it presents. So like hangga half of the population daw ang ma-infect ng COVID-19, or kaya hanggang next year pa aabutin yung spread ng disease. So baka naman may assumptions pala yung models kaya ganun yung mga results. So this on this part we are okay. After this lecture, I hope you will see mathematical models in a different light. So not just understanding the results as well, but as well as the assumptions it has. Okay, now the first work that I'll be discussing is that of Dr. Jomar Bahante. He's a faculty of the UPLB, and this work is published online in this link below. So it is entitled COVID-19 Epidemic Math Models and Insights Focusing in the Philippines. So these are the figures that I'll be presenting are just some of his results. And for more details, again, you can visit this link here. So here we see a figure simulated from an SIR model for the whole Philippines. Ito yung reflected lang dito sa SIR model ay yung I or yung infectious. So assumptions of this model are the epidemic started around February, early February, and that the spread of the disease is without intervention. Again, interventions like community quarantine, isolation, and so on and so forth. Okay, pop-up question. So here we have 4 lines. Yung blue, yung orange, yung yellow, and yung gray. So which among these lines is the epidemic curve? Now, if your answer is the yellow one, so then you are correct. So the yellow one represents the epidemic curve of the simulation. So again, as I have discussed earlier, ang epidemic curve, so kinakount niya yung day-to-day number of infectious cases minus the recovered minus the death. Meanwhile, this orange line here, and this gray one are cumulative number of cases. Ano ba yung cumulative? Ano ang pagkakaiba niya sa epidemic curve? Yung cumulative cases, pinag-a-add niya yung day-to-day number of cases. So from day 0 until today, so yan yung itsura ng cumulative number of cases na curve. So ang magiging trend niya talaga ay pataas ng pataas. Ito din yung mga nakikita natin na nire-release na numbers ng DOH. So right now, I guess we have 5,000 plus. So yun yung cumulative number of cases. So also, sa epidemic curve natin, we have the peak or yung araw kung saan may pinakamaraming number of COVID infectious cases. So on this figure, we have the peak at around end of May until June, I mean, until early June. Moreover, he also modeled the spread of COVID-19 cases for the Metro Manila. I think this is an SIR model. So here he has 2 scenarios for Metro Manila. So assumptions are 1, the epidemic started again around February. And second, the initial number of infectious cases considered here in the simulation is 15. And lastly, the spread of a community quarantine is imposed in the population. So further, it assumes that the community quarantine is effective. So highlighted na effective yung community quarantine. So what do we mean by an effective community quarantine? On our end, as citizens of the country, we follow the social distancing, I mean physical distancing. So the lecture this Friday will enlighten us why it has to be called physical distancing. Proper hygiene, use of face masks, proper washing of hands, and so on. And on our government's end, they should do active detection and contact tracing, um, mass testing, as well as boosting healthcare systems capacity. So they also should do some preventive measures such as avoiding mass gatherings and imposing travel restrictions. So that's effective community quarantine. So as a result of an effective community quarantine, number of COVID-19 cases will decrease. And we also reduce the value of the reproduction number. However, on this scenario, if the ECQ is lifted and the people will go back to their old lifestyle, by that I mean yung citizens hindi na mag-physical distancing, mag-wear ng mask, hand washing, boost ng immune system and so forth, and yung government natin hindi na mag-a-active tracing, active tracing and detection as well as testing, and wala na ring travel restriction at ina-allow na yung mass gatherings, what will happen is that there will be a rebound or so much increase in the number of COVID-19 cases somewhere on this part. So hindi lang ito lilimit sa isang rebound. It can be 2 to 3 rebound if we go to that old lifestyle that we had before this epidemic or this pandemic happened. However, for the second scenario, when after the ECQ, we still do the practices suggested by the DOH and the WHO, as well as our government still imposed interventions and preventive measures, the COVID-19 cases will decline and thus will flatten the curve. Now, as Dr. Bahante highlighted in these results, a long-term strategy is needed to fight the disease. Hindi siya tulad ng bagyo that after ng prediction, tapos na. And we can go back to, as he termed, epidemic-friendly practices. Now, the new norm is this norm. And it entails a change of lifestyle to everyone. Need an individual effort, but a community and a national effort as well. Now, for the second set of models that I'll be presenting is the first policy note released by the UP COVID-19 Pandemic Response Team policy note, so which is entitled Preparing for a Post-ECQ Scenario Analysis and Recommendations. I guess this is released April 6, a day before the President announced the extension of our ECQ for the entire Luzon. So on this policy note, we have 3 compartmental models used. One SEIR model, 2 SIR models, and 2 SIR model. Well, one SIR model is provincial city level population density based, while the other one is, I think, more of generic nation nationwide population density based. So according to the results, we have the peak size of the epidemic curves from these models ranges from 140,000 to 550,000. And this will happen at peak time around April until end of June. However, they also release the assumptions and limitations of these models. So the model's results are highly sensitive to number one, the initial values for the infected and the susceptible and the infected, which is largely based on the references and the DOH release data. Second one, we have the model parameters, which is also based on the references used by the modelers as well as models. And lastly, the model structures. So hence, we should focus more on the qualitative behaviors of the models rather than the numbers. Further, this figure is also presented in the policy note. So this, I think, is the combined simulation of the models. So this line counts the active cases per day. Question. So is this an epidemic curve? If your answer is yes, then that's the correct answer. So here counts the active cases per day minus the recovered and minus the deaths. So there's a strong assumption on this figure. On this simulation. So indicated here. So it assumes that the outbreak is controlled during the enhanced community quarantine. Again, just like before, on the earlier model, you also have an effective enhanced community quarantine assumed on these models. Also, this goal of lockdown is to improve the testing and the treatment capacity of our country so that we can raise the horizontal line or the capacity of our healthcare system. And with that, we have 3 scenarios after the ECQ. The first scenario is no interventions, meaning we go back to our old lifestyle, and that means, what will happen after is that we are going to have a rebound with a very large size of the epidemic, the peak for the epidemic curve, which is way beyond our healthcare system capacity. The second scenario, on the other hand, is the modified community quarantine. I guess this is related to the policy number 2 released by the UP COVID-19 which will give the number of COVID cases per. Here we have, what will happen is there will be a rebound, but not that high as compared to scenario 1, but it is below the horizontal line or the healthcare capacity of the country. So meaning ma-accommodate pa ng hospitals natin yung rebound na yon. But imagine if during the ECQ, hindi na-boost yung treatment and testing capacity natin. So we will have a lower health capacity, maybe on this line or below, even below. So what will happen is that, so yung read the line, and it is beyond the capacity of our healthcare system. Again, also, which is, we don't want that to happen. It's almost as if it's just like scenario number 1, even though modified community quarantine yung inimpose ng government after ECQ. And for the last scenario, we have enhanced community quarantine. So lastly, if we choose to continue the ECQ, we'll have a slow spread of the disease wherein cases will receive the optimal care. Okay, so ayun. So these are just some of the models, and you can still encounter more models, but I do hope that this lecture helps us to how we should understand the math models that we will see in the news and in the social media. And for the last part of my lecture are the takeaways from math models in general. So first, not the numbers, but the insights. So in interpreting math models, we should focus more on the behavior of the results of the models, or the insights they provide that we can get from the results rather than the numbers. Why? Again, the construction of the models holds assumptions already, for example, homogeneous population. Secondly, these models, for example, in the Philippine context, is also dependent on the DOH released data. So again, as was cited in the UP models, the numbers may vary, but possibly not the qualitative dynamics of these models. Second, call for more modelers, call for more access to data. Up until now, modelers or mathematicians appeal to the government to release more data and more data. More data, but also accessible data. More data entails more results, more realistic results from the models. Also, call for more modelers. So diversity on the models and its assumptions verifies and strengthens results and insights, especially when they deliver similar results, or also they counter-check each other's models. So not only in the present tayo magko-call for modelers, but as well as in the future. It is likely to happen that another pandemic will occur, but call for more math. Maybe the youth can, or our students would want to venture on this field as well. And lastly, I want to quote, all models are wrong, but some are useful. This is from one reference I've read. So models hold assumption to generate their results. However, with the guidance from experts, these can be put to good use. So countries like South Korea, UK, and London have been tapping modelers or mathematicians, quantitative scientists, and epidemiologists to deal with or to come up with strategies in dealing with the epidemics to create research-based policies. Again, that can post solutions for epidemics such as the COVID-19 pandemic. And with that, I end my presentation. Again, good morning, everyone.
Okay. Thank you, Miss Vanessa. But thank you for that very informative lecture. But we don't have much time. I guess we have less than 2 minutes or a minute for a recorded Zoom meeting. Uh, I guess I can entertain one question if we go po kitang hapot.
Uh,
Okay. Okay. I guess probably some are pressured because of the time limitation. But I we encourage everyone to send us a message. You can email it or send it. You can post it online. You can ask questions, and we'll try to answer your questions. Um, Probably as soon as possible. Okay. I guess I'll just take this opportunity to 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 announce na lang po for our lecture tomorrow. After learning the ECQ, we'll be having a lecture tomorrow on the economics implication of the COVID-19 to be delivered by Mr. Roland John Bulao. So please follow us and um, see you guys again tomorrow. So mabalas pong maray. Thank you.